Hi, my name's Amy and I'm a rehabilitation therapist at Vita Health Group. If you have been referred to exercise classes, you will have been seen within our physiotherapy team and undergone an assessment to ensure that you are suitable for the classes as per an inclusion and exclusion criteria. The timeline happens in that you're seen within the team, you're referred to the classes. In an ideal world, you are compliant with exercise classes and also completing the same exercises at home on a regular basis. And then you come to the point where you can self-manage at home with the exercises that you learnt in the class. The class should be suitable for your activity levels, which will have been assessed prior to your referral. However, if anything in the classes is either too easy or too hard, your class lead will be happy to make any adjustments for you, whether that's making things easier, harder, more challenging, things like that. The benefit of classes is that they offer more regular input and increased motivation to comply with rehab exercises, which is beneficial in a group setting, makes it a little bit more social, and also sort of clarifies any confusion or any difficulty with specific exercises that may have been a barrier beforehand. We aim to teach individuals how to self-manage their conditions after assessment, showing that they are safe to do so, and it equips you with skills to maintain progress at the end of the course of classes. The classes are approximately 30 to 40 minutes in duration. This includes a warm-up and a cool-down. There will always be an opportunity to ask any questions or voice any worries at the end of the session. If you need to, your class lead will always be happy to have a chat with you after the class is finished. They're also always available to advise on management if you've got any worries or signpost towards any other treatment services if necessary. The exercises are low impact and gentle, and they're designed in such a way to safely strengthen and support the body and its joints and muscles and all the things we need to get you strong from your sort of various injuries. If your pain worsens during the class beyond a level that's familiar to you, please let your class lead know so that they can take the appropriate steps to keep you safe. We will be able to tell if you are doing the exercises correctly or if they need to be altered to better suit you. You are entitled to 3 to 5 classes dependent on the location. So that's 3 at Central Court in Orpington, where the clinic is based. In external locations, so places like Bromley Parish Church or West Wickham, you may be entitled to slightly more, so up to 5, and that's because there's slightly less demand in the external locations. If you do not attend a class, you're not entitled to another one. So if we have to cancel one for whatever reason, so on things like unexpected bank holidays or staff shortages or sickness, you will have another one booked in its place to ensure that you don't miss out on your course. We recommend that you choose a day and a time that you can commit to consistently. We tend to see a far better success and recovery rate from class candidates who also complete the exercises at home in their own time as well. Your best bet is to complete the exercises little and often. So normally from the class templates, we will have a range of exercises, normally about 15, and our advice is always to sort of pick 3 or 4 that best suit you and try and complete those daily to every other day, as that consistency is what is going to be most beneficial in maintaining your rehab.